everyone, welcome back. This topic will cover about fluids and electrolytes and arterial blood gases, which is really important for NCLEX RN. So let's get started. You can download the template on the description. And this presentation is for the purpose of private study and research. I have used Kaplan, UWorld, Registered Nurse, RN, NCSBN, and a few other resources for my studies, as well for these presentations. First, we're going to talk about fluids and electrolytes like potassium, sodium, like 0.9%. Yeah, like there are so many electrolytes. But before we even get into it, we need to understand the intracellular fluid and extracellular fluids in order to understand how those electrolytes going to affect it, or the fluid's going to affect our body volumes. So intracellular fluid, ICF, we all know is inside the cells. And extracellular fluid is outside of the cells. And then it could compose of intravascular fluid, which is the blood plasma, interstitial fluid, and cerebral spinal fluid. Okay? Okay, let's go to the next one. I'm just going to drag that a little bit. So, for fluids and electrolytes, we got isotonic, hypotonic, and hypertonic. Let's start with isotonic. So I just draw a picture to sort of let me know that. What happened to the fluids, the solution, 0.9% and lactate ringer? What happened when they are inside the blood vessels? They will maintain the extracellular and intracellular fluid, so they will maintain at the same level. So the condition they use for such as hyperkalemia, dehydration, and surgery. Contraindicated, we need to know. They're not suitable for hypertension and for increased ICP. Watch out for fluid overload. And then I put the same management if let's say NCLEX RN, I tell you a question, patients on 0.9% for the saline IV infusion for the last 24 hours, and he has started developing certain fluid overload symptoms, and what's your priority? Oh. So hypotonics, what happened is you have increased intracellular, so as a result the cell will swallow, so the fluids will go inside the cells. Solution as following. Now 5% dex in water, when itself it's isotonic, but when you infuse into our blood vessel it becomes hypotonic. So that's why I got those two there. Condition we can use for hypertension or hyperglycemia. Contraindicate burn trauma, as they already have hypovolemic. Watch out for cell lysis, because we are infusing lots of fluids into the cells, and as well depletions, so our blood volume will probably drop more. Hypertonics, what happens is the cells, the fluids inside the cells go out. It go out to the extracellular, which the extracellular fluid's gonna be increased, but then the cells are gonna shrink. These are the solutions that I use. These are the solutions for hypertonics. How I remember the solution for these three is, so 0.9% saline, LR, those are two easy solutions to remember. Here, 0.25% to 5%, or 0.225%. What I remember here is these are the bigger number, and then combined with other number. Like say those numbers are much bigger than this one. So that's how I differentiate it. So condition you can use for increased ICP, cerebral edema, burn, ascites. So again, watch out for fluid overload. The table here is just an example. You can sort of modify it according to your study notes. But the way I put a layout as it is, so it's easy when we do the NCLEX exam. It actually covers lots of NCLEX questions, and easy for us to remember and to understand. We're going to talk about arterial blood gases. But before we even get into how do we know the value, like we got the value, but how do we different, like is a respiratory acidosis, respiratory alkalosis? We'll get that to a bit later. But first, for respiratory acidosis, you have decreased respiratory, which means going to be increased CO2. And then what happened to our blood volume, electrolytes? For the conditions, see the patho, decreased respiratory rate. So anything that decreases our breathing rate, it's gonna cause respiratory acidosis. Managements as following. And then for respiratory alkalotic, it's opposite, increased respiratory rate, and therefore decreased CO2 because we're blowing off too much CO2. The conditions such DKA, asthma, and pain. Our aim is to keep CO2. Breathe into rebreather bag. Now, keep CO2 with DKA is our body compensation to get rid of, sorry, I'm just got confused. So metabolic acidosis, you have decreased HCO3 and then increased acid. Potassium, you have increased and potassium. Conditions such as DKA as well, and decreased acid excretion such as insufficiency of kidneys and renal failure. Managements as following. For metabolic alkalotic, increased HCO3, which decreased acid. Then you have decreased potassium, which also known as hypokalemia. Causes could be loop diuretic. And then our management is to keep CO2 because CO2 is acidic and we want to increase acidic. Now, I would definitely recommend you to go to this website, Registered Nurse RN. That's her YouTube video. She's the one actually make me understand arterial blood gases and able to answer the NCLEX RN questions. NCLEX RN question like to give you the numbers, and then you need to figure out are they respiratory acidosis or respiratory alkalosis, full compensate, partial compensate, not compensate. Based on the video that I saw, I have summarized in a way that I understand and simplify it. So here it is. So the first one, if PaCO2, of course you have to know the range, pH 7.35 to 7.45. Left side is acidic acid and right side is base. HCO3 22 to 26. PaCO2 should be 35 to 45, but 35 gonna be base. So that's why I swap them around. That way it's easy to remember. Left is the acid, right is the base. So PaCO2 45 to 35, PaO2 80 to 100. So if the pH is, when they give you a question, if pH is in the base, HCO3 is on the base too, then is metabolic, because HCO3 is to do with metabolic, not respiratory. So metabolic base, so alkalosis. And then uncompensated because PaCO2 is normal. It's not doing anything to help with HCO3. See, even if we don't understand it, if you don't really understand, what you can do is, as long as PaCO2 or HCO3 is on the middle, then that's uncompensated. That's how I remember. So two questions to think. Which value is with pH? PaCO2 or HCO3? If it's PaCO2, it's respiratory. And then you just need to see, is it in acid or base? If it's acid, then it's respiratory acidosis. If it's with base, then it's respiratory alkalotic. Which value is within normal range? So that's what I mean. If it falls in the normal range, then it's going to be uncompensated. For this one, pH, for example, if it's acid, and then HCO3 is with acid as well, so that's metabolic acidosis. Now, it's not in normal anymore, so that means it's doing some compensation. So if it's on the base here, on the opposite side, then that's partial compensate. Same here. Let's say oxygen's respiratory PaCO2 is on the base side as with pH, so that's going to be respiratory alkalosis. And then is it in normal? No. If it's on normal, then it's uncompensated. But the HCO3 is on the acid side, so that's partial compensate. So I remember them based on the graph. Again, question, which value is with pH? PaCO2 or HCO3? Which value is compensate? So here, it's compensate. But here, it's not compensate, so it's in the normal range. Now, next one is about full compensate. I just want, you know how we got 7.35 to 7.5, which is a normal pH level. The 7.40 is going to be the middle line for it. We're going to use this graph to determine is it acidotic or alkalotic. For full compensations, the table is going to look like, the graph going to look like this. You've got the acid, normal, base, all filled out by the numbers here. So firstly, look at pH 7.36. 7.36, that's on acidotic side. Okay, so that's going to be acidosis. And acidotic is HCO3, so that's metabolic acidosis. Full compensate, the base is on this side, so it balances out. Next one, for example, pH 7.44. So pH 7.44 is alkalotic, and here it's on the right side. So you're gonna go to the right side here. On the right side, you got the base here, PaCO2. That's respiratory. So respiratory alkalotic full compensation. For full compensations, if pH is in the normal range, then that's full compensation. You see how here in the normal section, for this one, normal is it's empty, and here normal it will have either PaCO2 or HCO3. But so if it's in the normal pH, that means full compensations. Next step is to determine is it in acidotic or alkalotic. And that way we determine this part. Next one is it respiratory or metabolic? Then that depends. Is it on the right side? If it's on the right side alkalotic, then it's PaCO2, for example. If it's on pH 7.35, then it's going to be on that side, acidotic. HCO3 is here in the acid. Again, if this acid here is PaCO2, then that's going to be respiratory acidosis. Okay? I'm going to give an example here. So So we got pH 7.25, HCO3 28, PaCO2 48. So the NCLEX question is gonna be like this: patients having certain respiratory condition, and then did a blood value, and then here are the arterial blood gases. What are their situations? So pH 7.25 is acid, on the acid side, because 7.35, so 7.25 is going to be on the left side. HCO3 is 28. 28 HCO3, left is acid, right is base. So it's HCO3 is going to be on the base side. PaCO2 45 to 35. That's 45, 35. That's 48 on the left side, acid. Now, so we got pH, PaCO2. Let's work out. So that's gonna be acid. Here is to do with respiratory. PaCO2 is to do with respiratory. So the respiratory acidosis, partial compensate, because HCO3 is on the other side. It's not in the middle. If it's in the middle, then it's gonna be uncompensated. Next one, we got pH 7.32, HCO3 38, PaCO2 46. Let's work out. pH 7.38, 7.38. That's gonna be in the middle, so like that's sort of within the normal range. 38, HCO3 38, HCO3 38. 38 is gonna be base, okay? PaCO2 is 45 to 36, 45, 46. That's within normal. Oh, no, it's not normal. It's going to be on the left side. Acid, PaCO2. So you have, because it's pH 7.38, it's in the acidotic side. You're going to go to the left side and look at the left. What's on the left? Acid side. PaCO2, that's respiratory acidosis, full compensate. And that's it for the fluids and electrolytes and arterial blood gas. I hope that has simplified your preparation for the exam.